Let's look more closely at another healthcare system, the much maligned single-payer Canadian system.
How's it going, eh?
But first, we have to dispel a myth being tossed around by so many people. The myth is this: Canadians pay 40% in taxes. They do not. Using the official tax schedules and certified public accountants in both Canada and the United States, let's compare a Canadian with a taxable income of $50,000 and an American with a taxable income of $50,000. An individual Canadian with a taxable income of $50,000, depending on which province and town he lives, can expect to be walloped by about 26.7% in all federal, provincial, and local income taxes. An average individual American with the same taxable income, again depending on his or her state and town, can expect to pay about 29.2% in all federal, state, and local taxes, unless the American is self-employed, in which case he will pay around 36.7% in all taxes. If the Canadian wants health care for a family of 4, regardless of a pre-existing condition, it costs them a bruising $0.00, and he never has to pay a doctor bill. If the American wants the same health care coverage, regardless of pre-existing conditions, where he doesn't have to pay the doctor, it costs him as much as $27,000 a year. That's 54% of his income on top of his taxes.
You want a beer?
Eh?
Communist.
The Canadian pays 26.7% of his income for taxes and unconditional health care. The American would pay between 80 and 90% of his income for the same thing if he could afford it, which he obviously can't. So the American has to either find a job that pays less but offers health care or go without. Both options are extremely bad for the economy of the United States. But let's look at medical outcomes too. The Canadian system is not perfect. There are no perfect healthcare systems in the world. But there are 36 healthcare systems in the world that produce better health outcomes than the U.S., and no healthcare system in the world that costs businesses, the government, and most importantly, the consumer more money. But that does not translate into better healthcare. Canada ranks 4th in the world. The United States ranks 37th. According to the World Health Organization, a nonprofit entity that simply gathers health-related data and has no political stakes in our system, the U.S. has higher infant mortality, higher adult mortality, higher deaths from non-communicable diseases, higher deaths from cardiovascular diseases, higher deaths from injury, and a lower overall life expectancy. We have shorter hospital stays, less preventative care, less checkups, and less medical and post-operative follow-up. That's because our system is better. The primary purpose of our system is to make money. Healthcare decisions are made by insurance companies based on their profits, not by doctors based on medical need. Support real healthcare reform with a public option.